and pull. And you know, see what I'm doing? Pull. Good. Come on, pull. Pull. Good. And pull. I'm rowing with her, all right? This is a nice way of getting your patient out of synergy, and to what's happening is that you're using her whole body. You're using the whole trunk control. Now, you said rowing, right?
Yeah.
Did they do it on the mat?
We did it in the pool and on the mat.
Okay, so what do they tell you it does?
Does it work against the reflexes or the...
So look at my hands. So this way, and then this way, all right?
Yeah.
Yes.
Yeah.
Okay, so you're gonna do some rowing, all right? It doesn't have to be done in the pool, because a lot of subacute places don't have pools, unfortunately. And you may not want to get in the pool with your client, even if they had one. But the pool is good, so rowing this way. Okay, now, do we have a broom anywhere?
I see a stick. It might be attached to a broom.
What's that?
What's over there? Do we have a broom or some? Well, we can use my cane.
A stick.
Okay, stick. Okay, watch. Okay. So, put your hands. Okay, and if they cannot may hold on, there is a, and remind me to ask Louisa to show us this also. There is a glove that you can put the person's hand in, and it's locked around. Okay, so 2 hands. Pull me. Good. And push back. Push.
Oh, push you this.
Yes,
Okay.
back. There you go. Pull. And, oh, our broom is going. We gotta try to keep it on 4. Push. Good. And pull. Okay. And push. And pull. And then you can do that. You can take 2 sticks. Give me that. Hopefully of equal height. Okay, this needs to be higher. But you got the idea. And we're gonna go like this and like this. You got it? Like this.
What is this called?
Okay, well, this is reciprocal patterns of movement. All right? There you go, like that. Pushing and pulling, pull, and push, and pull. So you do that, okay? Then you could hold this one. Okay.
You can put a plunger.
Right, exactly. Try to hold it. Okay, you got it?
Inside or outside?
Inside.
Okay.
Okay. So we're going to just go back and look at what I'm doing to her. Okay. Now pull me back. Oh, you strong. And so back and forth like this. All right. So back and forth. This is why it's so important to get your patient out of the wheelchair and onto the mat. All right. So just do some things like this. Now let's do a little. Hold it. Now, are you right-handed or left-handed?
I'm right-handed.
Okay, so this is the arm. That's right? That's involved.
Okay.
Okay, so instead of having your patient, I'm sorry. Instead of having your patient sitting like this,
They bear on the
they're bearing weight, all right, on the involved arm.
The only thing, I have a question with this.
Yes.
Wouldn't
They
you,
might-
you have to be on the mat too to like help
Yeah,
stabilize?
to help them, absolutely. So you're going
Maybe
to
like
be
this.
on that side, okay, and then,
Right. It's like the picture, right, from the book.
yeah, yes.
Or tell them to like maybe reach something here and give it to
Like
you
this way.
over there.
This way.
Yeah,
Because like this is supposed to keep my weight, but then build up the muscle in this arm.
exactly. All right, it's so important, and I really believe in getting the patient up as quickly as possible. think of this person who's had a knee replacement. You know, the minute you stop breathing, they get you out of that bed, and you're bearing weight on that knee, whether you want to or not. The same thing with the stroke patient. Once they're medically stable, then you want to get them on that. We have a mat in the clinic for a reason. It's not there to collect dust. It's there really to try and work with the patient. Now, if at all possible, you want to take that to another level and put the patient. Now, I would not do this by myself. I would do it with another therapist. Putting the person, if at all, do some mobility. Putting them in quadruped, all right?
While in quadruped or sitting?
Sitting, while I'm sitting, just doing this. Just twisting, reaching for something, reaching for something, reaching for something. That's the only way that you're going to get the trunk muscles to build up, all right? They've got to get this to work. Then, once you see that, getting them, if at all possible, in quadruped. And then, and that takes work. That's why I'm saying, don't do it by yourself. You've got to have another therapist who is going to help you. And hopefully your patient is not going to be afraid, all right? And if they can't go in quadruped, put them in prone. Prone is on your belly, right? And use a bolster. Put a bolster underneath them so they can do some type of activity. And once they can do this and they can stand up and bear weight, they may have to wear an AFO, an ankle foot orthosis, and that's fine because it's giving them support and preventing deformities to the lower extremity. Then they can start standing at a treatment table. Or if you have a standing box, a standing table, those are very useful, but you want to get them out of the standing table. The standing table, the person walks in, it's like a box. We have one in the ADL room. Remind me to show it to you guys. Where they stand in and there's a table in front of them, but they can't fall down. And you can gradually get them to stand for increments of time and doing activity. Because you want them to learn how to bear weight. If they have neglect, it does become an issue. It does become a problem because they're not feeling that weight on the involved side. So that perceptual difficulty of having the neglect really compounds you trying to do the mat stuff, but you still should try to do it. All right? Questions?